Welcome to the Dizziness Summit. I'm here today with Dr. Christy Drizwicki, who's a specialist in functional medicine and neurofeedback. She works at the Neurologic Wellness Institute in Wood Dale, Illinois, and we're really happy to have her here. So thank you for being here, Dr. Christy.
Thank you so much, Dr. Traster. Happy to be here.
And I'm excited because we're going to talk a little bit about Meniere's disease and your take on Meniere's disease and things people might be able to do at home who have Meniere's disease. And Meniere's disease is a disease people have heard about, but I'm not sure people really know the details about it. So why don't you get started and tell us a little bit about what is Meniere's disease?
Okay, so I'll start by kind of explaining what Meniere's disease is. It's a disorder of the inner ear. So it's a disorder of the fluid within the inner ear, which can lead to symptoms of dizziness and hearing loss and fullness in the ear, even ringing in the ear of low-pitched tones. And so a lot of times that fluid buildup can lead to a lot of those symptoms, and that's what's referred to as Meniere's disease. Some of the common causes of Meniere's they're still being debated. So a lot of people don't know what the cause of Meniere's is. A lot of times it's diagnosed after many other causes of dizziness are ruled out. But some of the major causes and correlations are an imbalance in what's called the endolymph, or the fluid within the inner ear. So if there is too much being produced or not enough being absorbed, that can cause pressure and swelling in the inner ear, and that's also referred to as endolymphatic hydrops. Other common causes that would cause that imbalance in endolymph would be things like infections, whether it's viral or bacterial. A lot of times if there's a dysfunction in the immune system, actually there's more and more research coming out that if the immune system is hyperactive or if there's an autoimmune component, sometimes that autoimmunity can attack parts of the inner ear, and that can lead to inflammation and swelling within that inner ear, which then again leads to the dizziness brought on by Meniere's disease. So we also have to look at other causes such as different sources of inflammation. So it could be anything. Inflammation could be characterized as anything that causes any form of stress on the body. And sometimes if that's long-term chronic stress, then that inflammation never has a chance to calm itself. So if that inflammation is constantly present and constantly fueling that either overproduction or lack of absorption of the fluid in that inner ear, then pressure just continues, and so do the symptoms that are associated with that pressure. So I want to start with this slide, actually. So I want to kind of explain what a healthy inner ear looks like and an inner ear with Meniere's disease. So you can see, I'm going to use my mouse here, but you can see the endolymphatic sac here. If that is healthy, then there's a healthy amount of fluid within this inner ear, okay? And so there shouldn't be a lot of pressure. There shouldn't be a lot of that fluid pressing on the walls of that inner ear. But if there is too much or a lack of absorption, then fluid gets backed up, and that's where that pressure occurs, as you can see down here with Meniere's disease. So the backup could occur here in the sac. It could occur in the tube here, or in any part of the inner ear, really. Pressure of the inner ear distorts messages being sent to the brain, and therefore that can cause our brain to kind of get confused as to where we are in space, because we have balance centers in those inner ears, and hearing occurs in those inner ears. So if there's too much pressure or inflammation going on there, then those messages get distorted, and all of a sudden our brain doesn't know where we are in space, and so that's where the dizziness occurs. Okay, so there is not a single test that we can use to diagnose Meniere's disease, but there are a couple general tests that are usually recommended by practitioners. So we can look at just a general hearing test, just to determine hearing, or if there's hearing loss or the extent of hearing loss. We can also do a CT or MRI scan, and also an assessment of the inner ear with different forms of stimulation, like water, air, or change in position. As of right now, considering there's no known cause for Meniere's, then there's no definitive treatment either. So really, it's symptom management at this point. A lot of times, general practitioners will recommend a low sodium diet or to avoid caffeine, alcohol, and tobacco. And the reason behind that is because it will change fluid balance in the body. And if there's too much fluid and pressure in the inner ear, obviously we want to balance that as much as possible. Okay. A lot of times those things too, caffeine, alcohol, depending, can be very inflammatory. So just from an inflammation standpoint, eliminating some of those can be helpful on multiple levels. Increasing water consumption, believe it or not, increasing water consumption can lead to more of an ideal fluid balance because it helps to regulate some of the hormones that are involved in that. A lot of practitioners will use medications to help with the nausea and the dizziness or vertigo. So that is more of a Band-Aid approach. Diuretics help to relieve a lot of that fluid buildup in the inner ear. Steroids actually found to be helpful in some cases if there is that autoimmune component, because the steroid will help to calm the immune system temporarily. It's not an ideal form of treatment, but sometimes if that is the case, steroids are helpful temporarily. Antibiotics have been used at times if an infection is a component of it. However, that can lead to some significant inner ear destruction, which may lead to some permanent hearing loss and maybe even dizziness without any relief. So something to be aware of. A lot of people recommend just general vestibular rehabilitation too for balance training. However, in a lot of the people that we see, everything is so different. I mean, obviously, just from this presentation alone, we know there are so many different possible causes of Meniere's that just a general rehabilitation program may not work for everyone. So it has to be really specific and really take into account an individual's history. And then as far as a last resort, sometimes surgery of the inner ear is recommended. But again, that the risks of that leading to permanent damage are a little bit higher. So usually that's last resort, and even other practitioners may not recommend that right off the bat. So, but that is another form of treatment. As far as the functional and neurological approach to Meniere's disease, this is where we have to look at the individual as a whole. So just as I mentioned, Meniere's can be caused by multiple different things, and they still don't know if there is a single cause or multiple causes, or if it's a combination of causes. But we have to look at the patient history. We have to look at prior infections, what their lifestyle looks like. Are they moving? Are they moving too much? We have to look at stress levels. We have to look at a family history of autoimmunity or disease or sickness or anything like that. Because if anything is causing significant stress on the body, then it increases inflammation, and inflammation alters fluid balance in the body and in the inner ear. So if that fluid balance presents itself in the inner ear, then it's going to lead to dizziness and hearing loss, because there are many, many sensors in the inner ear that control those things. So we have to look at how the brain and nervous system and body are working together. And we also have to pay particular attention to the vestibular system, as the inner ear is part of the house of that vestibular system. So looking at the individual on a very individualized basis versus using a cookie cutter protocol for Meniere's is something that is significantly important.
So thank you so much, Dr. Christy, for that talk. That was great.
You're so welcome.
I know from personal experience, we work with a lot of patients with Meniere's disease, and I know a lot of times the attacks could come out of nowhere, but even after the vertigo attacks, people could still feel dizzy or still feel imbalanced for an extended period of time. And I know from my experience, we're really successful helping people with dizziness, with imbalance in between the attacks, but the attacks could come completely random. And so we really have to look at more of a comprehensive approach to each individual's health, their lifestyle, their nutritional factors, their immune system, and a whole load of things to try to look at what is triggering their Meniere's disease, and then what we can do to hopefully try to prevent the attack from happening again, or at the very least try to slow down the frequency so they have less attacks each month or each year. So from that standpoint, what do you like to do with patients who have Meniere's disease from more of a holistic level?
So if they still have dizziness remaining, then we have to look closer at lifestyle components. So we have to look at their diet. We have to look at stress levels. We have to look at if they have other infections present. So first, I like to use turmeric. I actually do like to use a lot of turmeric. It's a good anti-inflammatory. I like CBD oil for that same reason. That helps to reduce the inflammation. However, I do like to focus on lifestyle, something that can be sustained long term. So we have to look at diet. A big thing with diet is removing inflammatory foods, which they're different for everyone. So it's really looking at the foods in the diet, the timing of eating, how much they're eating, and when they're eating them. So a lot of times, the main thing is what I'll start with is removing a lot of the common triggers, like gluten. Gluten can cause inflammation in the body, but can also fuel autoimmune conditions. So it doesn't matter what the contributing factor in that case, if it's autoimmunity or if it's just inflammation in general, but removing that can kind of knock out both of those. Gluten and dairy are big ones, and a lot of times I'll remove eggs. I make it pretty simple off the bat: gluten, dairy, and eggs. Not everyone has an issue with all three of those, but I've seen a good amount of people with high levels of inflammation feel better after removing them. So it's something that we can try with that individual and see if that helps. Lifestyle, definitely focusing on breathing, focus on deep breathing, and depending, a lot of what we do at NWI, we're going to assess the individual's breathing and correct any areas that need to be corrected to ensure proper breathing, because that can help to calm the system and therefore decrease inflammation as well. Meditation is very good. Neurofeedback is obviously a big one that we can use to help calm the sympathetic nervous system, decrease stress on the body, and decrease inflammation. So I use a lot of that as well. That's been significant in helping helping individuals manage stress levels. And then we also look at other lifestyle components as far as physical movement. Movement is important, and obviously if dizziness is a major problem for individuals, it can be hard for them to move regularly. But anything, walking, gardening, cooking, cleaning, anything like that can be really good to help to get more oxygen to the brain and nutrients to the body. And movement is just good for input into the brain in general, and therefore it leads to a calming of the system and a decrease in inflammation too. So those are my go-tos.
Well, I appreciate that, and thank you again for your time and your talk. It was great, and I'll speak to you soon. Thank you.
You're so welcome. Thank you so much.
Thank you.